brain and pain. What is the connection? This is the second in a series. We started last month talking about the vagus nerve because the vagus nerve is very tied in with this. And next month, on August 16th at noon, we will be talking more specifically about all the various ways that you can activate your vagus nerve. But for today, we're going to focus on pain. And the first question is, what is chronic pain? And how is it different from acute pain? It's important to know this because the solutions to chronic pain lie in understanding what makes it chronic. Acute pain we all know about. Acute pain occurs because we are protecting ourselves from dangerous insults from the environment. So if you're putting your hand on a hot stove, you will automatically withdraw it because the heat tells you this is a dangerous area and I need to get my hand away from it. And if you do get burned by accident, we all get burned on the stove or the oven, it burns, you feel it, you might get red spot, you might have a blister, you put ice on it, feels a little bit better, it's sore for a few days, and then as your skin heals, the pain usually goes away. There are some instances where the pain doesn't go away, and it may not be from a burn, it may be from some other insult to your nerves. And when the pain persists well after the insult, the tissue damage has happened, we call that chronic pain, especially if it's gone on for 3 months or more. Some of this chronic pain becomes what we call neuropathic pain. And we're pretty sure that a lot of people with burning mouth syndrome have neuropathic pain. And neuropathic pain is pain without an injury or insult. The nerve fibers are sending pain signals to your brain without any obvious damage. I hear from people who have seen multiple practitioners, dentists, periodontists, oral surgeons, ear, nose, and throat, allergy doctors, who say their mouth looks fine. Everything looks fine, but yet there's pain. So there are signals going to the brain without any obvious sign of damage. Now I have to tell you, with burning mouth, there may not be obvious signs of damage, but studies have shown that tongue biopsies show a degeneration of certain types of nerves in the tongue. This is not a biopsy that's done by your regular oral surgeon. These are biopsies that are studied in research centers. So it's difficult to get a biopsy that will show nerve degeneration, but yes, indeed, it has been shown with burning mouth pain that there is nerve degeneration of certain types of nerve fibers in the tongue. Still, you can have neuropathic pain, which is a burning, stabbing sensation, a tingling sensation. It can be a numb sensation. Some people have what's called allodynia, which means that even a light touch. I have one patient who has neuropathic pain in his feet, and the sheet in his bed touching his feet is painful. It's not perceived as touch. His brain perceives it as pain. And then there is besides allodynia, there is pain that occurs that is much worse. It's a painful insult, but with neuropathic pain, it is much more severe than a small pain, and that's called hyperalgesia. And the real question is, how does an acute pain get turned into a chronic pain? And there are some amazing studies, and people aren't guessing. They're using MRI, magnetic resonance imaging scans, and there is something called a functional MRI that can show actually what parts of your brain are lit up when you're feeling pain. And it turns out that with the development or transition from acute pain to chronic pain, the areas that light up in the brain are completely different. So with acute pain, there's lighting up of certain areas, the location of the pain, the intensity of the pain, but then somehow the pain gets converted into chronic pain, and what lights up are the emotional centers of the brain. And like I said, we're not guessing at it. It shows up on functional MRI scans. And it's possible that the gut-brain communication contributes to that, what we call chronification of pain, when acute pain stops being an acute reaction and turns into a chronic, everyday, months and years on end type problem. So how widespread is the problem of pain? It turns out that 1/3 of Americans have chronic pain. That's a lot. 20% of them, or around 7%, have neuropathic pain. And it's estimated in a variety of studies anywhere from 7 to 10% of the entire US population has neuropathic pain. 30% of that is caused by diabetes, because elevated blood sugars traveling in your circulatory system attack nerves and damage the nerves. So conquering diabetes, which is definitely a nationwide issue, the diabetes rates are going up every year significantly, decade by decade. It's a lifestyle issue. It's a food industry issue. It's a toxin in the environment issue. It's a stress issue. There are a lot of components to diabetes, and our focus as a nation really should be on lowering the diabetes rates. So a good part of neuropathic pain is caused by diabetes, which we know what to do about that. So what about the other neuropathic pain that's not diabetic pain? It turns out that there is a connection between your gut and your brain, and it is very connected to pain. There are billions of microbes in your gut, even more than you have cells in your entire body, and they consist of bacteria, fungi, protozoa, viruses, and these can regulate your nervous system. They can regulate both what we call your central nervous system, which is your brain and your spinal cord, and your peripheral nervous system, which is the nerves that innervate your hands, your feet, your skin. That's the peripheral nervous system. And it turns out that the microbes in the gut have input that affects nerves all over your body, whether it's central or peripheral. And how do they do it? There have been scientific studies in animal models of pain that showed that unbalanced gut bacteria, what we call dysbiosis, made them less resilient to pain. And we see dysbiosis. We treat patients based on stool testing, where we look at a whole variety of organisms in your stool and look at, do you have enough of the healthy bacteria that keeps your body on track, keeps you resilient, lowers your pain threshold, or do you have a lot of unhealthy bacteria that are overgrowing for one reason or another? And when you have a lot of unhealthy bacteria overgrowing, we call it dysbiosis. Dys meaning not healthy, not good, and biosis referring to your microbiome. So dysbiosis can cause pain, and we have seen really dramatic things in regards to burning mouth syndrome with the issue of the gut-brain connection. And what's an example of burning mouth syndrome being affected by the gut-brain connection? We have a patient whose burning mouth syndrome was really reduced to very insignificant levels on our program. You know, our basic burning mouth program is hormones and low-dose naltrexone. She was doing really well until she needed a colonoscopy. And with the colonoscopy prep and clean out, her pain came raging back. So I investigated and learned at that time a lot about the gut pain connection. And we ended up putting her on a series of supplements and treatments that enabled her body to get restored and to find her way back to her low pain level that she had had before her colonoscopy. And I'll tell you about some of those things and how they tie in. So how do the gut and the brain communicate? Well, it's the microbes in the gut that communicate with the brain by mediators. So what are the mediators? Well, for one thing, there are what we call metabolites or neurotransmitters. GABA, or gamma aminobutyric acid, is produced in your gut, and it directs the enteric nervous system, which is, how we say the gut has its own brain, it's the second brain. Well, there are nerves all around your intestines called the enteric nervous system, and GABA affects that enteric nervous system. GABA also goes up to your brain and affects what happens in your brain. The same thing happens with serotonin, a neurotransmitter. 95% of it is produced in the gut. It affects the enteric nervous system. It also, by way of the vagus and the circulatory system, affects your brain. GABA and serotonin are calming neurotransmitters. Some of the treatments for burning mouth syndrome are based on GABA's calming effect. So medications like gabapentin and pregabalin work on those GABA receptors. So it's important to have a microbiome that produces enough GABA and serotonin. The other neurotransmitter that's involved in this gut-brain communication or microbe-brain communication is called glutamate. And glutamate is an excitatory neurotransmitter, and that can worsen pain. So you want to have microbes that make plenty of GABA and serotonin and less of the glutamate. Now, glutamate is necessary, but excess glutamate is not good for nerves. It is neurotoxic. Some of the supplements that we use block glutamate receptors. We use L-theanine a lot for anxiety and also for burning mouth syndrome because it blocks glutamate receptors, which are part of the pain-producing microbiome brain communication. The microbes in your gut communicate with your brain and the rest of your body through immune chemical mediators. Now, before COVID, nobody ever knew what the term cytokine meant. But since COVID, you know about the cytokine storm. And cytokines are immune chemicals that are very inflammatory. Now, cytokines are important for a short time to stimulate repair processes. But when cytokines and chemokines are produced unremittingly, it inflames your body, it inflames your nerves, it inflames your brain. An inflamed brain is a brain that doesn't function well and is more susceptible to pain. The gut-brain communication also takes place through hormones. And there are some important hormones in terms of pain. There's one called GLP-1, glucagon-like peptide, that protects nerves. The other thing about GLP-1 is GLP-1 agonists or medications that act like GLP-1 are potent diabetes medications. So they may also end up being something that we can use for chronic pain. But right now they are being used for diabetes, and they are very potent hormones in terms of getting diabetes under control. They go under the names of things like liraglutide and semaglutide. There also is something called neuropeptide Y, And neuropeptide Y is produced by gut microbes and communicates with your brain, and neuropeptide Y decreases pain. And then, of course, the huge connection of the vagus nerve that facilitates a lot of communication between our gut and our brain. And how is this microbe gut-brain connection important? What disorders do we know are a misstep in this important communication? We think that Alzheimer's is partly a miscommunicating problem between the gut and the brain. Parkinson's disease, depression, and also pain. I'm going to spend a few minutes talking about some of the non-vagus ways that we might be able to treat pain through this gut-brain connection. Probiotics. So our patient whose burning mouth syndrome got much worse after her colonoscopy prep, we gave a very high dose probiotic called Visbiome. There are also important communicators called short-chain fatty acids that are produced in the gut by microbes in the gut. These short-chain fatty acids are important communicators, and one of the most important ones for the gut-brain and gut pain connection is butyrate. And so we gave this person butyrate. We also gave her acacia fiber, and acacia fiber is a fiber that, whether you tend to constipation or tend to diarrhea, kind of normalizes your stools and feeds your healthy bacteria. So using acacia fiber will help to promote the proliferation and multiplication of healthy gut bacteria. So these are ways that manipulating what is going on with the gut can have a significant influence in pain. The other thing that has been studied, and it's something that is not approved yet for use in pain, is fecal microbiota transplantation. And you might have heard about fecal transplantation. It's definitely indicated for people who have a bacteria called Clostridia difficile. And Clostridia difficile can overgrow in the colon and cause unremitting diarrhea. It often happens after people have been under antibiotic treatment and can be very resistant to treatment. And a fecal microbiota transplantation will take care of it in most cases. There is a company now that is actually making fecal capsules for use for Clostridia difficile infection. And I'm hoping that they will broaden their indications to chronic neuropathic pain. Vitamin D ends up being really important for a proper gut function and communication with your brain. And what we know is that most labs like LabCorp and Quest say anywhere between 30 and 100 for your vitamin D level is, quote, in the normal range. 30 is way too low. So you definitely want your vitamin D up in like the 50, 60, 70, 80 range. And it usually takes, if you're down at 30, or sometimes we see people at 20, it can take quite a lot of vitamin D to get your levels up to where we want them. What we've seen with some of our burning mouth patients who have started using vitamin D upon my recommendations before they got on the rest of our program with hormones and low-dose naltrexone and some of the other things we do, is people with very low vitamin Ds in the 19 to 20 range, by taking adequate amounts of vitamin D, their burning pain improves. So that to me is a very specific confirmation that vitamin D is very important, and it may be important because of the gut-brain connection and therefore the gut-nerve connection. The other thing that happens with the chronification of pain is that pain goes to a completely different area of your brain when it becomes chronic. It goes to the emotional center of your brain and it gets amplified. And studies by some of the biggest people using, like I said, MRI, functional MRI of the brain, show that the emotional center is what lights up in chronic pain, not in acute pain, which was back pain of less than 2 months duration compared to people who had back pain of 10 years duration. So addressing emotional factors, and trust me, I know a lot of people with pain have been written off as it's all in your head, we can't find anything. I'm not addressing that. That is not what I'm saying. But what I am saying is we know that physiologically what's going on in the emotional center of your brain is amplifying and contributing to your pain. And anything from early life stresses to depression, to anxiety, to the stress of having had a surgery affects your microbiome and therefore can affect your pain. So a lot of what is going on now in the chronic pain psychology field is addressing the psychological issues that are holding you back from becoming resilient to pain. Again, not saying it's all in your head, but recognizing the emotional contributor so it can be addressed so you can get pain relief. And some of the things that we refer people to work on this aspect of pain are the Curable Health app, which you can get on your phone, the Pain Management Workbook by Rachel Zoffness, which is a physical paperback workbook where you write things down about how your pain affects you and take control over what you're telling the pain and telling your primitive brain so it stops being in control of you and in control of your pain. These have been very effective ways of lowering pain and in some cases completely getting rid of pain. The other thing, of course, getting back to the vagus nerve, is that the vagus nerve senses what your gut microbiota is doing, and it transfers that information to your central nervous system. The vagus also dampens inflammation and gut permeability. So gut inflammation and gut permeability. Gut permeability, you may not know that term, but you probably have heard of leaky gut. And this is a condition where that one layer cell thick lining throughout your intestine, each cell should be very tightly bound to the cell next to it. The binding gets weakened and the contents inside your intestine, food particles that should never get into your bloodstream before they're completely broken down, slip through these loose junctions and get into your bloodstream and set up an inflammatory process. Sometimes that inflammatory process leads to autoimmunity. Sometimes that inflammatory process worsens pain. It can cause any number of things: brain fog, joint pain, fatigue. There are a lot of things, but we're focusing on pain right now. So the vagus nerve dampens inflammation and lowers the leaky gut, lowers that permeability, and that alone modulates the composition of your microbiome. The vagus nerve has the potential of restoring your microbiome. So I'll just mention briefly some of the ways to stimulate the vagus nerve. We'll be going into detail on this, like I said, at our next Instagram Live, which is August 16th at noon. Meditation has been shown to stimulate your vagus nerve. Deep breathing, cold water, putting your head or face in cold water stimulates the vagus nerve. Singing, gargling, and using a transcutaneous vagal nerve stimulator, which is an electrical device, also stimulates your vagus nerve. And we've had some really impressive evidence of the vagal nerve stimulator's effect as far as gut motility with patients that we have who either had a damaged vagus nerve due to surgery or damaged enteric nervous system due to diabetes, and their gut slows way down. The muscles don't work, they don't squeeze food and move it along, and as a result, people like this have nausea, vomiting, poor absorption of nutrients, difficulty eating any amount of food. And we have 2 patients who have used the vagal nerve stimulator, and it's made a really big difference. So that is as far as seeing the effect of the vagus stimulation on what we call motility or movement of muscle in the gut. So that's all I have to tell you about today. I want to remind you that we have a course for the public called Hope for Burning Mouth, where you can learn more about a whole variety of treatments for burning mouth syndrome. Our next Instagram Live next month on August 16th at noon, where I'll be joined by our health coach, functional nutritionist, Jessica Craig, and we'll be going into depth on how to stimulate your vagus nerve. So if we have any questions, I'd be happy to take them now. Can burning mouth and burning toes be associated? That's a really good question. And I mentioned one of our patients who had burning mouth syndrome and a foot neuropathy, which wasn't so much a burning of his feet, but a stiffness of his feet. And he is the person who had allodynia, so when the sheets touch his feet, it's very uncomfortable. It doesn't just feel like a sheet touching them. So yes, it's possible that there is something going on with the nerves in your body in more than one location. And certainly everything I've said about the vagus nerve and the gut-brain connection may well apply to both of those areas of your body. Somebody asked if this is pertinent to psoriasis. So that's a good question. Anything pretty much that's going on your skin, and almost all autoimmune conditions, and psoriasis is an autoimmune skin condition, has its origin or at least part of its cause with imbalance in the gut. So for people with skin problems that are persistent, the dermatologist will give you a topical cream to use on it, and it reduces inflammation on your skin, but it doesn't get at the underlying cause. So what we do for any skin condition or any autoimmune condition is do a very thorough evaluation of the gut microbiome, looking for gut inflammation, looking for the short chain fatty acids, looking to see if you are producing enough immunoglobulins, which are fighting proteins in your gut, looking to see if you have dysbiosis. And by correcting those things one by one, we very often help people either get rid of their skin problem or significantly diminish it. And thank you, all of you too, and thank you for your kind words of appreciation.